This conference will now be recorded.
अद्य गुरुवासरः अथवा बृहस्पतिवासरः श्रावण कृष्ण तृतीया दिनांक 6 ऑगस्ट 2020 सहस्रयुगं पुंखादितये शङ्खं चक्रं जलौकान् दधतमृतघटं चारुदोर्भिश्चतुर्भिः सूक्ष्मस्वच्छातिरुद्यां शुकपरिविलसन् मौलिमं भोजनेत्रं कालाम्भोदोज्ज्वलाङ्गं कटितटविलसच्चारुपीताम्बराढ्यं वन्दे धन्वन्तरिं तं निखिलगदवनप्रौढदावाग्निलीलम् प्रौढदावाग्निलीलम् ब्रह्मणो हि समारब्धाम् आत्रेयाद्येषु पूजिताम् अस्मदाचार्यपर्यन्तां वन्दे गुरुपरम्पराम् आयुर्वेदरतं वन्दे माधवाख्यं महागुरुम् आयुर्वेदामृतं सर्वं शिष्येभ्यो यः प्रदत्तवान् द्रष्टाज्ञानी दृष्टकर्मा कृतकर्मा तथैव च अध्यापकोऽभिषक्श्रेष्ठो महान् संशोधकः गुणैरेतैः समुदितैः यत्कार्यं प्रतनोति सः समृद्ध्यर्थं हि कार्यस्य वयं प्रयतामहे सरस्वत्यै नमो यः प्रसादात् पुण्यकर्मभिः बुद्धिदर्पणसङ्क्रान्तं जगदध्यक्षं क्षते आत्रेयं प्रथमं वन्दे आयुर्वेदजगद्गुरुम् आयुर्वेदामृतं सर्वं गृहीत्वा हि सुरेश्वरात् अग्निवेशादिकेभ्यो यत् प्रयच्छत् मुनिसत्तमः प्रथमं तन्त्रकर्तारम् अग्निवेशं नमाम्यहम्। पुंखादित्वे ते पुंखाक्वाथे भयाकल्पसिद्धं तैलं द्विजातिनम्। तो पुंखा ishara so this is quite simple, just punkakvatha and abhayakalpa dvijartinu. So for danta shula, I don't think whether this is available in the market and it's very easy to prepare. So we have many cases of danta shula as such, and it is quite troublesome. So many times I tend to use Chandra Prabha and for just keeping it in the mouth, and Irimeladi Tel that already we discussed. But this might be Punkhadi Tel should be a better choice specifically for Dantashula. So Dvijarti Nut. Ramathadi Tel. Ramatha Lavanopetam Tailam नालिकेरस्य विधिना सपयसिद्धं दन्तशूलाम् आशुनाशयति. So Hingu and Lavana, these are only thing in Narikela Taila and Siddha, made Siddha with Kshira. One tola each. So Hingu 1 tola will be quite big amount. And Nalikera Taila 32 tola. So if they make 2 tola, then 4 times of that will be 8. Here actually it is 32. Now again, this seems to be traditional, the percentage particularly. Otherwise, Hingu and Lavana, 1 part each. Taila, Narikel Tail, 8 parts, and Bokshira, 32 parts. And Payas Siddham, Payaha is either milk or water, both the meanings are there. So maybe we have to look for this. Is this available, Ramathadi Tail? Hmm. And the Padashruti just Dantashula only, or Dantashula and Nashunashe. So only Dantashula. There is no other Padashruti. नहीं लगता मुझे. Uh, at some places there is milk and salt combination, and with Narikel Ambu, Narikel Taila. So we may try to do this. Or paya can be taken as water as well. Since this is traditional and the percentage of the ingredients, it's also traditional. Which oil for wound with maggots? Kanjal Kapur is a fine for maggots. Surasadi Siddha is also good. I don't know whether it is available. Anjuda Nimba Nirigunti Swarasena Vipashitam Nishakalka Yutam Tailam Oshkaroga Vinashana. Anjuda. Anjuda. Mumyamalaki. Nimba Nirigundi Swarasena Vipachitam Nishakalka Yutam Tailam Oshkaroga Vinashana. Prepare there with the above drugs, Kalkas Neha, etc. Now there is this lip balm that is available and it's sold more frequently or in much quantity as such. Maybe if we use this Taila for ingredient as lip balm and then add whatever is to be added externally to make it convert into a balm, that might be better. And these are all available, so not an issue. There are few cases of osteoporosis, truly speaking, and there can be some cancers not directly associated with osteo, but in the oral cancer there are certain cancers seen like this. We may have to look for Sharira of osteo if we find some references about that. But dryness of osteo is very common, and Krishna Vaivaranya of osteo is very common. That is why this lipstick is in use. So maybe for this cosmetic purpose, and of course for health as well, this might be a good choice. Bhumya Malaki Nirgundi Nisha. So फार अवघड नाही आहे भूम्यामध्ये पण निर्गुणी आहे हा स्वरसन यष्टी नहीं है दिनेशवल्ली स्वरसय विपक्वं तत् चर्म कल्केन पुनर्नवस्य सारे च तैलं वृणरोपणार्थं प्रशस्तमित्येव वदन्ति तज्ञाः. Dineshvalli Tvak. So that is Arkavalli. So maybe Surya Pool. Valli Swarasa. But these are not Valli as such. Surya Pool. So what exactly is Dinesh Avalli that we have to see? Kalke Punarnavasya Sare Cha Tailam. Kalka and Sara. So this is for Vranaropana. There is one part Vranaropana Tail which was being used in Tarakan Hospital, and that used to be you work very fine. So Durvadi Tail, Dura Saras Kalkapyam Tailam Siddham Vranehita. Lata asते, Arkapatri, Tylophora indica. So this is a separate, it's not Surya Fool then. So Durva Swarasa Kalkapyam Siddham Tailam Vranehitam. So this is also simple, only Durva Kalka and Swarasa. Siddham Vranehitam. So this is also very simple. Tiradi Taila. तिलशिष्टाभ्यायोः कल्कं महिषी क्षीरसंयुतं शीर्यमाणेषु केशेषु केशस्थापनमुत्तमम् तिलयष्टिमधु तैल महिष क्षीर. Actually, there is no mention of preparing Siddha Taila. Tila and Yashti Kalka with Mahisha Kshira to be put on the head in the Kalka form. Shiryamaneshu Kesheshu. So, in hair fall, Keshapata. Kesha Sthapana Muttamam. So this may form a part of our beauty treatment because this is a very common problem. So Khalati is a very, very big problem as such. If you prepare that, they are saying prepare Taila and that is fine. But truly speaking, this is not Taila, this is just Kalka and Mahisha Kshira, that's all. And Tila Yashtava Kalka, not very difficult to prepare as such. How long should we keep it, etc.? This will remain as such questions. Nirgundit Nagaraditai. Nagara Sandhava Magati Mustaq Okshura Vasa Alasunaihi Vasala Lashunaihi Tailam Arka Suparna Rasena Karna Rujan Shatakoti Nihan. So Nagara Sandhava Magati is Pippali Mustaq Okshura Vasa. What that the Vasa Lasunaihi. Okay. So Vasa Lashuna and Arka Suparna Rasa, sharp rasta. Ripened leaves. Suparna would also mean good leaves. Graya or something like that. Karana Shula. Shatakoti. So severe pain in the ear. In a specific quantity, Karnashula, जीवन्ती जलदेवदारुजलदत्वत्सेव्य गोपीहिमं नारीत्वं गतकं नवागुरुवरा पुण्ड्रावबिल्वोत्पलम् धावन्यौ सुरभिस्थिरे कृमिहरं पत्रं तीरेणुकं किञ्जरुकं कमलावयं शतरूणीं दिव्यें वसिक्वाथये तैलादरसं दशगुणं श्रेष्ठतेन तैलं पचेच्च सलिलेन दशैव वारान् पाके क्षुकेच्च दशमे सममाजदुग्धम् नस्यं महागुणमुषन्तणुतैलमेतत् for Tiladi it is written दूध में तैल सिद्ध करे. Yeah, that is true, but there is no mention of preparing oil from that. Just kalka is to be put on the head in milk. Tilayani yashti kalka with milk. There is no mention of preparing oil. This is falling under this Taila Adhikara, so we may consider it as and Mahisha Kshira particularly, that is yet another important aspect. So this is regular Anutaila given in Vagbata. जीवंती जल देवदारु जलद त्वक दाल्सेव्य गोपी हिम दारवी त्वक मधुक प्लव अगरु वरी शतावरी पौंड्राव पौंडरीक बिल्व उत्पल धनौ भावन्य बृहति कंटकारिका सुरभि तुलसी बकुल स्थिरा शालिपर्णी पुष्पिपर्णी स्थिरे कृमिहर विडंग पत्रम त्रुटि एला रेणुका हरेणुका किंजल्क कमलाभय आकाशोदक आकाशोदक so divya jala it is to be so 10 times of water divyambasi what hai shatagune divyambasi so 100 times divya jala. So for this we may have to collect it and store it, this divya jala. And Shakuntala Deshpande, one of the followers of Bhagavad Shastri, was doing it for whole of her life. So she was drinking only this Divya Jala. So this is again one of the important things. Adding 1/10 quantity of Tila Taila to the Kashaya repeated to her 10 times during last you have to put Ajakshira. It is used as Nasya Urdhvajatrugata Roga. So anyway, this is available. This is the made as per Patra is available from ABS and it's quite strong. So now I'm using this in my clinic, keeping bottles handy in my clinic for giving Nasya. And Ghanonnata Prasannatvat Skanda Grivasya Vakshasya Drudendriyasvapalitaha Bhaveyurnasya Shilinaha. So Pratimarshanasya actually we should be doing every day. Marshanasya is indicated only for particular conditions, etc. But Pratimarshanasya we should be doing every day. Unfortunately, I am also not doing it, but we have to think about this, and in order to keep the health of Urdhvajatru Pradesh. This is very good. Sahadevi rase tailam sadhayen matiman vishak षडंग कल्कम सक्षीरम सर्वद्वर हरम परम षडंग कषाय द्रव्य कल्क सहदेवी रस भोक्तीर Sahadevi is what exactly? I'm not sure. And Shadanga is might be Shadangodaka Kalka or something like that. So whether this is available, Sahadevyadi Taila, and particularly Abhyanga is to be used by this in Jvara. So Sarvajvara, that is the Falashruti. महावृक्षार्कजे दुग्धे मधुचिष्टेन साधितं सदेवी तेल for abhyantara or bahya. For bahya, I think there is no problem whether we can use it abhyantara as well. Varnonia cinerea. Okay, is this available? महावृक्षार्कजे मधु दुग्धे मधुचिष्टेन साधितं तैलं संकृत सकृत प्रयोगेण दुष्टव्रण विरोपणम. This is called as Varna Ropana. How can tail be used in Jvara? Won't it increase it? Might be there is a Togbeta Jvara. There is a concept. अन्यस्य सन्धिपातोत्थो यत्र पित्तं पितः स्थितं प्रतिकोष्ठे त्वाराहं विदधाति पुरोनुवा तद्वत् पातुकफौ शीतं दाहादिर्दुस्तरस्तयोः. So either the pitta or kapha they are staying in work. And then if it is kapavata, then it is shita purva jvara. If it's vatpitta, then it is daha purva jvara. Dahadi is duskara or something like that. So, and there is a vakshesha jvara also. Only the jvara is remaining in the twak. In this intuition, this might be confusion. This might be useful. पावसाळ्यात सगळीकडे उगवते जांभळी गोंड्यासारखी फुले येतात. सहदेवी. Okay. Please share picture. So Mahavruksharka is Lohi Kshira and this Arkaje Dukte Chistena Saditam Tailaps Sakrut Prayogana Dushtabrana Viropana. So though it is said as Brana Viropana, it is Shodhan and Ropan both. Mahavruksha and Arka. So both are there. Arka Kshira is also there. Dushtabrana. So this might be tried particularly in cancer patients. That will be better. There are many cancer patients having open wounds, particularly oral cancers and breast cancers in advanced stage. So Mahavruksharkaja Taila, whether it is available in the market, of course this is very Tikshna Ushna, but Madhuchishta is one of the ingredients. And even this Pinda Taila or Manjisthadi is an option. Ratyadi also contains Madhuchishta. Balashatam Chindarvaha Padam Rasnashta Bhavikam Jalaraka Paktva Dashabhaka Stite Rase Dadimastu Ikshaniryasa Shuktais Tailadakam Samaihi Pached Aja Payodhansham Kalkai Devi Palonditai. Brana Ropana Tail available आहे का याच नावाचे रसशाळेचे आहेत, त्यात घटका द्रव्ये वेगळी आहेत. So Varnaropan that is available, that should be Mama Opal's part by Rasashala particular. I don't think this is available from Rasashala, Ayurveda Rasashala. So whether it is available, it will be available from this Kerala pharmacies only, VS, ABP, etc. May have to see. व्यस्त आहे. Okay. But still you are saying that this is different. Now Manoj Parade has quoted. So ABS, then that might be this Taila. We have to see whether it is the same. There was Varnaropana earlier as well. So whether this is the Varnaropana or different one. And if it is that available, then we may try to use it. That will be better. So Shati Sarala Darvela Manjishta Guchandane Padmakati Bala Musta Suparani Harenudi यष्ट्यावसुरसा व्याघ्रे नखर्षभकजीवकैः पलाश रस कस्तूरी नालिका जातिकोशकैः स्फुटा कुङ्कुमशैलेय जाति कटुवचाम्बुभिः वक्कुन्दुरुक कर्पूर तुम्बरु श्रीनिवासकैः लवंगनतकोल कुष्ठमांसी प्रियंगुभिः स्थौणेय तगरध्यान वचामदनकपल्लवैः सनागरैः सिद्धैः दद्यात् चात्रावतारिते पत्रकल्पं ततः पूतं विधिना तत्प्रपूजितम् श्वासकासज्वरमूर्च्छाच्छर्दिगुल्मक्षतक्षयम् लिहशोफौ अपस्मारम् अलक्ष्मीं च प्रणाशयेत् बलातैलमिदं श्रेष्ठं वातव्याधिविनाशनम् पाने नस्येन्वासनेऽभ्यञ्जने च स्नेहाः काले सन्नगेते प्रयुक्ताः दुष्टान् वातान् शान्तिं नयेयुः वन्ध्या नार्यः पुत्रभावानार्यं पुत्रभाजश्च कुर्युः वैद्यरत्नं से पण आहे. Okay. So this is very famous Bala Taila and I also use it very often. There is one variety Shuddha Bala also available in the market, and that is only Bala. And this is quite a big part. And this is might be available by Dhanvantara Taila in the market. So we just go through. Shatti Kachara Sarala Daru Devdar Ela Manjishtha Agaru Chandan Padmaka Atibala Musta Shurpaparani Mudgaparani Mashaparani Harenu यष्ट्याव सुरसा व्याघ्रनख वृषभक जीवक पलाशर रस कस्तूरी नालिका जातिकोश कोशक जातिफल स्फिक्का कुंकुम शैलेय जाति जायपत्री कटुकी वचा अंबुभी रिबेर त्वक कुंदुरुष्क शल्लकी निर्यास कर्पूर धन्वंतर वाटत नाही तुम्बरू धान्यक श्रीनिवासक लवंग नख तगर कोल कुष्ठ मांसी पेटामांसी प्रियंगु स्थौणेय तगर ध्याम रोहिष त्वचा मदनक प्लव नागकेशर बलामूल 400 तोला चिन्नरुहा गुळची 100 तोला रास्ता 50 तोला जल 25 द्रोण Same part is in Ashtanga Hridaya Vataveda Chikitsa. But what it is called, Balatail only. And it is called as Balatail, not Baladi Tail. Actually, there are so many ingredients. And this is very peculiar. Balamula 400, Chinnaruha 100, and Rasna half of that. Hmm. So the part is quite Dadimastu Ikshurasa Shukta Ajakshira. The Falashruti is also wide. Shwasa Kasa Jwara Murcha Chardi Gulma Kshatak Kshaya Liha Shofa Apasmara Alakshmi Nashana Sarvavata Roga Vandhyatva Hara. For the first time, he has written Alakshmi Nashana, otherwise, he is omitting that. Murcha Chardi Gulma Kshatak Kshaya Liha Shofa Apasmara. Vandhyatva Hara. So Nahivata Drutayonir Narinam Sampradushyati. So this might be a better option to go for Karmavruddha Anuvasana with Balatela of this part. So this is what is available by Balatela. Vaidyaratham has given reference Ashtanga Hridaya only. Okay. Yeah, it can be taken internally, there is no doubt. So Pana Nasya Anuvasana and Abhinga, all in all ways. So I think if it is Vata Pradhanya in Mandhyatva particularly, then one may go for this. Now anyway, there is problem of this PCOD, and the menses are very much delayed. And I have come across cases after the age of 35, 36 for Vandhyatva. They have already tried IUI, IVF, etc. And there is PCOD. To my surprise, in 2, 3 cases, I do remember that the menstrual cycle was not set. It was still delayed like 2, 3 months after 2, 3 months or something. But she conceived. And this can be shocking as well. There is one lady who has one son, I think 20 years now. Her age is 41. And her menses were very irregular. Used to come after 6 months, 1 year also. Obeys. And she came to me with amenorrhea for 2 or 3 months. I think it was 2 months. I felt something different by pulse, and I asked her to go for sonography. She ignored it and came back to me after 4 months. And again, I insisted, "No, you go for sonography." And there was a pregnancy of 3 or more months, 4 months or something like that. And then she continued with the pregnancy. She delivered a baby. So this is very surprising at the age of 41, when the cycle was not at all set for so many years. She could conceive. And this is my experience in many infertility cases, that the menses may not get settled, but they can conceive. So now I'm trying to use this Vedangadi Taila for Brahmavruddha Anuvasana, followed by Doshahara Basti from Vagbhatta, and then Putriya Anuvasana, again from Vagbhatta, for both, and maybe Mustadi Yapana, etc. So initially, instead of going for Bhanwan, this Vedangati Taila, it might be worthwhile to go by this Bala Taila itself for Anuvasana, Kanuvruddha Anuvasana, and then go for Doshahara Basti, followed by maybe Niktadi Yapana. And at that time, Putri Anuvasana might be given. So, anyway, in PCOD, I have been more emphasizing on Sahachara oil or Sahacharadi oil. That is also fine, but might be Balatel of this part would be of help. And if there is no patency of the fallopian tube, then also this is a better choice to use. So it is containing this Dadimastu, which is Srota Shodhi as such. And so blocked fallopian tubes that this might be good. Of course, one may you go for Uttar Basti in that scenario. That is all. That also works. But this Taila may also be used in that particular issue. There are certain cases in which there is tubal pregnancy and that fallopian tube is removed. So she has only one fallopian tube. That is another important. That is also blocked. Then they say there is no choice. You have to go for IVF. But I think in this scenario, we may try to think of this Bala Taila. And particularly for infertility, this should be. No, there is difference in part of Ashtanga Hridaya. Somebody has put the whole part. Balashatam Chindarha Padam Vasnashtabhagitam Jalarkashate Patva Shatabhagastite Raste Dati. So there is no difference between the part. It's the same part. वाग्भटात शतभाग स्थिते रसे असा पाठ आहे तर सहस्रयोगमध्ये दशभाग स्थिते रसे असा पाठ आहे शतपाकी every has shatapaki available in 50 ml. How come this is going to be shatapaki? जलारक शते पत्ता दशभाग स्थिते रसे दधिमस्तु वगैरह वगैरह पचेत तत्वं विधि. So if it is prepared 100 times, then this is quite peculiar. There is no mention about this in English translation. Project Sanjay Radhamsham Talkairevi Palonvitai. Patrakartam Tata Putam Vidhana Tat Prayojitam. There is no mention of preparing Shatapaka. Only thing is, if you are reducing to 100 or something like that, then this is going to be very strong. It's not Shatapaki like other Shatapaki, preparing it 100 times. Uh, you have to reduce it, the Kwatha, to 10, 1/10 or 1/100th. And this seems to be in Vagbhata, it is 1/100. And Shatabhaga Sthite Rase, Shatapaki, AVS has Shatapaki available in 50 ml. So this must be very concentrated. And what is the price of 50 ml? So anyway, I think this is a better part to use them. Polonlitaihi pache. 50 rupees for 10 ml. Not that costly. If they are preparing it like this, then it should have been very costly. But surprisingly, not 50 ml in 10 ml. Okay. बलाया शतगुरुचा पंचविंशति फलानि रत्नाय सार्धानि द्वादश फलानि एतच्च जलाढकशते पक्त्वा अढकमात्रस्थिते क्वाथे दध्यादिमस्तु भिस्तुल्यैः तैलाढकमजाक्षीरस्य अर्धाढकं शक्यादिभिः फलोन्मितैः पचेत्. Yeah, that is true. That I understood. So 100 times water to be added and reduced to only one part. So 1/100th is to be kept. Remaining 99% is evaporated. So this is quite concentrated quartz. Okay, let us try to use this. If it is available in 10 ml only, that is a problem. Uh, might be available in 100 ml or something like that. We have to see whether this is available in little more quantity or something like that. So, but this is rather surprising that such a part is available in the market, and may try to use. Now the price barrier might be present in some patients, but anyway, IVI etc. treatments are so costly that people go for them. Whether sir drop pramane वापरायचे. Yeah, that is possible. So it is to be considered as Shatapaki and may use it in drops, or we may add Shuddha Bala oil to this for Basti and other things. That Ajakshira available. Yeah, it is available. Villages it is available in cities. This is a problem. But I have kept few case patients on Ajakshira and even in cities like Pune. And we have to search, and it is very costly. They are selling it 200 rupees per liter. So we may have to think about this in a better way or something like that. कल का गंध द्रव्य सा है कुष्ठ रुग्णाना with infertility must be drug of choice. Now, to understand the rationale behind such a big combination, is a tough job. So generally, if we are using for infertility PCOD, these are obese, but may think of Karshia along with PCOD or Vandetva, not PCOD, but Vandetva. That should be fine, and can use it in that particular way. So anyway, today my audio recordings, I have expressed some different views, and when you listen to them, please give me your feedback about that. Basically, I started with Vaidika Vishwa Vihangama with a particular viewpoint that we want to have a bird's eye view about medical sciences as such, the eligibility criteria for admission, the course, the curriculum or syllabus, post-graduation, research, then clinical practices, government's role, insurance company's role, pharmacy's role, etc., etc. And after completing about 100 audio recordings, I feel that I'm not proceeding in that particular direction. I'm getting carried away with a particular thought process at certain time or something. So I decided to have a break for that, think over more seriously, and to be focused. What I was doing it extempore. So whatever thoughts that would come into my mind, I was expressing them. This, when no doubt good thoughts, these are good thoughts, but not focused on a particular topic or a particular direction. So I expressed my view that I may stop here right now and come up with more focused approach, maybe in few days. And the same thing has happened about Hindi talk, Swadeshi or Paryavaran Samvardhaka. So therein also we started with Swadeshi movement, but replacing China in many aspects. But at the same time, we should not be doing something which is against nature. And therein also I am getting away from the original theme and such. So whether to have a focused approach or keep on with extempore views or something, that's a big issue. My personal attitude or my personal liking is not a focused approach. It's something like this open thought process, and whatever that comes into my mind, I try to express. But still, I'm not reaching the objective, fulfilling the objective, this might be uh, thought once again. So I'm thinking about this, and as I said, there is another issue coming up: Cancer Holistic Guidance Forum, and so from tomorrow onwards, I will be speaking of this about this in Hindi only, not in Marathi. I take some time to think about this Vaidika Vishwavangama in Marathi. May resume after a few days. But I may have a meeting this Sunday morning, 8 o'clock, about this cancer guidance, holistic guidance program or forum. Basically, I thought of putting some information on net and about why this holistic approach and what are the advantages of holistic approach and how the people keep on suffering with going only with conventional medicine, etc., etc. These are few things, and how we have to reach the root cause of cancer and change our lifestyle, food habits, milk, etc., etc. And though I have written book in Marathi and English, that has a limited scope because it reaches only to my patients and not really by booksellers or something. So this will have a very broad perspective. So I'm basically thinking of it in three languages: English, Hindi, and Marathi. But I would like the people in the group to translate it in varieties of languages. So Rita Shaha can translate it in Gujarati. Shweta can translate it in Kannada. There might be somebody from Tamil Nadu, I'm not sure, or somebody from Kerala, Malayalam. And I'm not aware about some people from Bengali or some other places. And maybe Kalyani Shinde, Somali Shinde's daughter, in Portuguese, or Nauko, she is not present. I don't know what has happened to her, but she might do it in Japanese language. And somebody we think of from Germany. I'm not sure whether Anupama Awake is capable in doing it in Japanese language, but Naoko should be able to do. And then there will be people coming up from varieties of countries and trying to do it in their languages. And I'm thinking how to go ahead with this. I may start it this with my own company right now. And initially I will invest money into that. But later on, everybody may participate in this, and everybody would get benefited from this. So those who are desirous, those who have completed my both courses, foundation course and in-depth course, they are more appropriate for this. Those who have been in practice and particularly practicing cancer with my holistic approach are capable of this, and I have some idea for cancer patients. Okay, you may call after this lecture, and there should be holistic guidance regarding cancer, and of course there will be patients coming to this forum, and they need to be guided. So what we will do is some interactive part in this. This language is one more aspect that I want to come up with. So there will be a selection of language in there. it will be better for a particular patient in particular region to read that language. And maybe Vaidyas in that fluent in that language would be of use. That can be the thing. And my book in English or Marathi may be taken as a guideline for this whole journey, etc. And we can reach out the global society, etc. So Hindi will be beneficial for whole India and such. Marathi for Marathi people across the globe, and English for other people, and we have Japanese and Portuguese and other languages as well. So this we can definitely think of. So I think this will be a good step. So from tomorrow onwards, I will start speaking about this, and I will be trying to be specific for a particular topic, and let us see how it goes. I shall let you know about this meeting on Sunday, and let us see how it progresses. So I think I will frame something. I will professional translator from various languages can do. It is for common people. That is also fine. That is also possible. And now I'm using this technology to translate. Sunday, please keep at 7. I don't mind, but I thought many people would like to relax on Sunday. Sunday. For me, it's not a problem. So we may keep it at 7. That is also fine. Now this is a machine translator translating this Vaideka Vishwa and Vasarogyatsa, etc. into English with audio and word text format. I haven't gone through the word text format and not also listened to the audios, etc. But this technology, and I think this should be available even for Hindi. I may have a word about that. And try to. I have thought processes about that marketing. So anyway, but this is a catchy subject and there is a need in the society. So I think this will be successful. Of course, if we go for marketing, then that should be fine. Deep learning technologies are also useful for translation. Please send me an email about this and let me understand it, what you are saying. So anyway, we conclude today and continue tomorrow with this, and keep on thinking about this forum, and we'll meet on Sunday. Ayurveda prakando nigadita iha hi शल्यतंत्र प्रधानः शिष्येभ्यः शाश्वतोऽयं निखिलजनकृपा व्याप्तचित्तेन येन आयुर्वेदस्य वाञ्छन् पुनरपि भुवने ताञ्च सुष्ठु प्रतिष्ठान् श्रेष्ठं धन्वन्तरिं तं प्रणमति च सदा वैद्यवर्गो हि नूनं वैद्यवर्गो हि नूनम् विरम्यते व्याख्यानव्यापारः श्वः पुनरपि मिलिष्यामः